Well, Dr. Sear, I see you're on a break here from the conference. Thanks so much for joining us here in our little plugged-in studio.
You're very welcome.
So you were telling me you're actually in Quesnel for about 40 years practicing and now here in West Vancouver.
73 until 2013.
And you came down here to retire, but you're actually still practicing.
I graduated 50 years ago, but I have to give present-day medicine, so I have to come to these courses to update my skills and my knowledge.
So how are you finding the conference this year?
Excellent. The short, sharp lectures are good. They're keeping us up to date, and I've learned an awful lot in this so far this week.
You know, we were talking about kidney disease and the prevalence of it. What are some of the symptoms that you look for or you see in patients that come to your practice that, you know, potentially have kidney disease?
Most don't have symptoms. I'm finding it when I'm looking for kidney problems in diabetics and in patients with hypertension and in elderly folk whom I'm giving medications to, that I want to make sure that they're excreting those medications. So most patients are totally asymptomatic.
Well, actually, you hit it right on the head. That's one of the challenges of the Kidney Foundation, is that it's such an under-recognized disease, and yet 1 in 10 Canadians is affected by kidney disease. When you see patients that have perhaps diabetes, hypertension, some of the high risk factors, are they aware of the link between that and kidney disease?
Usually not, and they're surprised when I tell them or show them on a graph that their kidney function is less than normal. And so they don't like to be classified as having kidney disease. I think the awareness is low, but when they think kidney disease, they think dialysis, and that's the next step. And they don't understand that this is a very slow, progressive process that needs to be looked after.
So when you see a patient, what sort of things might trigger to you that perhaps this is someone that should get their creatinine levels tested, or you know, that they might be at risk of kidney disease?
Anyone with hypertension who's on medications, anyone with diabetes who's on medications. We monitor their kidney function as a matter of good medicine and good course. And so these are people we're looking for that.
You were mentioning a little bit earlier also about the demographic within your practice as well. Is that something also that's a risk factor?
As people get older, their kidney function can, in certain circumstances, start decreasing. And so if we're going to prescribe medications for that sort of group, we will check their kidney function as a matter of routine. If they're coming in for a checkup because of some other symptoms, we will be checking their kidney function anyway.
Well, thank you so much for joining us. Great information, much appreciated, taking time out of the conference to join us here today, and maybe we'll see you here next year.
Thanks very much.
Thank you. Well, what an informative day here at the St. Paul's Hospital Continuing Medical Educational Conference. It's been a great opportunity to speak with some general practitioners, learn a little bit more about signs that they're looking for when they diagnose someone with kidney disease. Thanks for joining us. We'll see you next time on Plugged In.